Cyanosis.
What is cyanosis? Cyanosis is bluish discoloration of the skin and mucous membrane of the body due to increased amount of reduced hemoglobin in capillary blood. Types of cyanosis: 1. Central. 2. Peripheral. 3. Due to abnormal pigment. 4. Mixed. Central cyanosis. Central cyanosis occurs due to diminished the arterial oxygen saturation sites on skin and mucous membrane. Example: tongue, lips, cheeks, etc. In central cyanosis, temperature of limb is warm. Breathing pure oxygen, cyanosis decrease. Clubbing and polycythemia usually associated. Central cyanosis cause: A. Cardiac cause. Congestive cardiac failure. Congenital cyanotic heart disease. B. Pulmonary cause. COPD, chronic obstructive pulmonary disease. Collapse and fibrosis of lung. Pulmonary AV fistula. C. Abdominal hepatopulmonary syndrome. D. High altitude due to low partial pressure of oxygen. Peripheral cyanosis. Peripheral cyanosis occurs due to diminished flow of blood to the local part. Peripheral cyanosis occurs on skin only. Temperature of limb is cold in peripheral cyanosis. Applied local heat, cyanosis abolished or decrease. Peripheral cyanosis cause: A. Cold exposure, local vasoconstriction. B. Increased viscosity of blood. C. Shock, hypovolemic shock, cardiogenic shock. D. Raynaud's disease, local arterial constriction. E. Myocardial infraction. Cyanosis due to abnormal pigment like methemoglobin and sulfhemoglobin. Mixed cyanosis. In this type of cyanosis, extremities are cold and blue tongue present. Mixed cyanosis occurs due to acute left ventricular failure, mitral stenosis. Mechanism. In adult, on average, there is 15% of hemoglobin, 95% of which is saturated with oxygen and only 5% is reduced. Mean of only 2 to 3% is reduced hemoglobin, and the color of skin and mucous membrane is pink. When amount of reduced hemoglobin exceeds 5% in the capillary, the blood appears dark, giving the tissue a bluish hue. Differential cyanosis. 1. Only of lower limbs, patent ductus arteriosus, PDA, with reversal of shunt. 2. Only of upper limbs, PDA, with reversal of shunt in a transposition of great vessels. 3. Cyanosis of left upper limb and both lower limbs, PDA, with reversal of shunt and preductal coarctation of aorta. Sign and symptoms: fever, headache, difficulty in breathing, bluish discoloration of skin and mucous membrane. Example: tongue, nail, lips, etc. Chest pain, fainting, cold fingers and toes. Thanks for watching. Like and subscribe for more.